Hi, welcome to part 2 of Chapter 16, Employee Benefits, Group Life, and Health Insurance. Now, as an individual health insurance, the group health insurance is also affected by the Affordable Care Act. So the Affordable Care Act, one of its intentions was to make the group medical insurance more honest and more fair to employees. And some of the provisions we're going to go over here. One, applicants cannot be turned down or rated up regardless of their health condition. So they can't pick on individuals within the group who they may reject, saying that well, you're not going to be part of this group insurance, even though you're part of the employer group. We're not going to let you in the insurance because of you have these pre-existing health conditions, or if you do want to join, you're going to have to pay twice as much. So that can no longer happen, which is a good thing. So speaking of that, when we say regardless of their health condition, we're talking mostly about pre-existing conditions. So they can't exclude you because of pre-existing conditions. They can't exclude you based on lifetime or annual limits. Just because you've used a lot of insurance in the past, they can't, use that against you. And this is all things that the Affordable Care Act is going to protect the individual when they participate in the group insurance. So insurance companies may not retroactively rescind a policy because of any unintentional error. So this is basically, to explain this a little bit, insurance companies in the past, before the ACA, would look for loopholes and say, okay, we found a loophole where we can deny coverage, even though it's clearly an error, an unintentional error of the insured party, but we're going to use it against them to, rescind the policy and charge them the money. So they can no longer do that, which is really despicable anyway. Retention of coverage until age 26. So this is important to many parents. So in the past, it was pretty typical that your children will be kicked off your health insurance plan once they turned 18. In some cases, it was extended while they were in college, but typically no child would receive their parents' health insurance past the age of 22. So now, with the realities that many young people take multiple years before they get gainful employment to cover their own medical costs, having the ability to cover your children up to age 26 is very beneficial to a lot of people because of the fact that most children may not obtain decent health insurance until age 26 or older. So it gives them plenty of time to pursue not just a bachelor's degree, but also a master's degree and stay under coverage. And also prevents cost sharing for preventative services. So the ACA, which we talked about also in last chapter, is there to try to make these group insurance plans better and more fair to the participants. So there are other provisions that we could talk about, which is this, employer shared responsibility, which is another name for the employer mandate. What this requires large businesses to offer health insurance or pay penalties. Now, so for firms with 50 or more full-time equivalent employees, they must either one, they must offer health insurance coverage, or they must pay an annual inflation-adjusted penalty for each full-time worker that's not going to be receiving, insurance when they could have. So this is meant to encourage employers to offer insurance, but the one downside here is that they can offer the insurance, but doesn't really tell the employer that they have to cover the full cost or even part of the cost of the insurance. So there's still a loophole to this. So basically, it's mandating that companies with more than 50 employers have to offer a group health insurance. But it doesn't say that the employer has to contribute anything to the cost of that plan. So they could still offer the plan, but then expect the employee to pay 100% of the costs. So it really isn't it really isn't. No employer should ever have to face paying a penalty by not offering, equivalent insurance, because there's really, if they wanted to offer the insurance, they can do it in a way that's going to be no cost to the company. Now, let's see, what else do we have here? Now, the health insurance plans must provide the essential health benefits. We talked about these. We talked about these in the last chapter, and these are just the essential health benefits are the basics of what a plan should cover, and that is, you want to know exactly. It's the same as the individual, but that's covered in the last chapter, so I'm not going to go over each one of those individually. The small employer tax credit. So if you're a small employer, and the big thing is many Americans work for small employers. Now, if they have fewer than 25 full-time employees, and and they pay an average wage of greater than, or say less than $50,000, then they can get a tax credit up to 50% in the employer's contribution to the employee's coverage. So it's a way of trying to make it affordable for small employers to offer medical coverage when they have a small pool and maybe charge higher premiums because of the small pool. Now, the shop marketplace is creating a marketplace for small firms, just like they created a marketplace for individuals. We talked about last chapter. The shop will create a marketplace for small firms to get the medical and dental coverage plans. So it's trying to put a little bit more of a market in there, so that the small firms, and this is the shop is an acronym for Small Business Health Options Plan, and this is basically in a way to try to make it easier for small companies to participate in offering employees medical insurance. Now, required minimum medical loss ratio. This is, insurers must meet a minimum medical loss ratio of 80% for plans in the individual and small group, and 85% for large groups. So basically what we're saying here, if these loss ratios are not met, that the rebates have to be paid to the enrollees. So a loss ratio is percentage of each premium dollar paid to cover medical services and activities. So it's a way of trying to limit the amount of profits that a greedy insurance company could take. They're basically saying that, we're going to limit the amount of the money that you can keep as profits. So 20% of each dollar spent can be accounted for, expenses or profits of the company. And that's a way of keeping these companies from being greedy and trying to take up 50% of the transaction as their profits. Okay. Now it's also the ACA. Now the ACA, you have to understand, it was like the Wild West for medical insurance previously to the ACA. So the ACA puts down a baseline of coverage, what should be covered, things that tricks that the insurance companies have used for years, trying to weed them out and make it a case where even small employers can afford to provide insurance. And remember, large employer or small employer, there are no requirements that the employer has to cover any percentage of the cost of these group plans. It's up to the employer's discretion if they want to cover 100% of it, 50%, 80%, 10%. So this is why it's important, not only to find out what health plans your company provides you, but also how much are you expected to contribute to pay for the plan. Flexible spending accounts. These are the accounts we talked about in the previous chapter where you can take money out of your paycheck to put tax deferred, to put into the special account that you can use to pay for deductibles, co-insurance, co-payments, and other expenses related to medical issues. And as of 2018, that's around $2,700. And this amount that is allowed there's a limit. You can't put in more than say I think it's like $26,500. I'm sorry, $2,650 a year. $2,650 a year is the limit that you can contribute to pay for these things. Now you have to be careful because some of these flexible spending accounts, it can be set to a use it or lose it. So you don't want to overfund it and have this money go to waste, because not all the flexible spending accounts can roll over to the next year. So you want to be really careful with that. So out of pocket or out of network claim payments for emergency room visits. Claim payments for emergency room visits. So if you go to an emergency room that's outside of your hospital network, this must be the same payment amount as the amount paid for a visit to emergency room inside the network. So this is a good thing to have, because if you're somewhere else and you have to go to a hospital because it's an emergency, you don't really have a choice of the hospital you're going to. Previously, you could be hit with a extraordinarily huge hospital bill because you went to a hospital out of network. So now it makes it that you can use hospitals out of network as long as you get prior approval of the visit to the emergency room. So this makes it prevents you from having a gigantic emergency room bill because you went to the wrong emergency room. And typically when you're going to the emergency room, you're not thinking about what your medical plan is going to cover. You're just thinking about staying alive. So that's why you should always know what the requirements are for approval to visit an emergency room that's outside your network. And it may be that you have to call up within 24 hours of visiting or before you get there for pre-approval. You just make sure you know what it is. So if that happens to you, you can do it right away. A Cadillac tax on high-value policies. So in an effort to pay for the ACA, people who have are provided with a health insurance plan that exceeds more than $10,000 for individual coverage, there's going to be a tax amount paid for the premium that the employer pays above this $10,200 amount. So this is a tax. Basically, it's a tax on employers that provide these really inclusive and expensive plans. So if you're an employee and the employer is going to pay $20,000 for you to be part of this really great insurance plan, now only $10,000 of that contribution will be tax-free. The other $10,000 you have to pay tax on. So that really stinks. For one of the elements of the ACA I don't really like is that if you happen to have, and if you live in an expensive state like California or New York, typically most medical plans are going to be higher than $10,000 a year. So this is sort of a sneaky tax to help cover the cost of the ACA. Now, as far as the W-2 reporting obligations, so employers have to disclose the aggregate value of the plan's benefits on the W-2 forms, which means the amount reported is not taxable to the employee, but designed to be informational for greater transparency. So what happens at the end of the year when you file your taxes, they're going to ask you, there's going to be a statement you're going to get that's going to detail your medical plan and how much, what you're paying into it and what the cost of it is. And that's really for the purpose of one, transparency, two, making sure people have to pay this Cadillac tax when their insurance plans are expensive. Okay. Key features of group medical expense insurance. So let's talk about some other key features. A new group medical expense plans sold today generally have the following features. And we're going to go over each of these in a little bit more detail. So comprehensive benefits. So when they say comprehensive, they mean a lot. So this is benefits to cover employees with no lifetime limits or annual limits on the benefits. So this comprehensive coverage means that they cover a lot, if not everything. And this is, the benefits provided have to meet or exceed the essential health benefits required by the ACA, which is like the bare minimum. So typically benefits include coverage for your primary care, surgeons, specialists, chiropractors, other provisions, and that's what we would call comprehensive. It's going to cover everything: emergency rooms, prescription drugs, things of that nature. Calendar year deductions mean that in a calendar year, the first $1,000 you charge to your medical plan, you have to cover. And then after that, they cover everything. So that's a typical situation. Co-insurance requirements. So when we talk about co-insurance requirements, we're talking about medical expenses that require an employee to pay a certain percentage of the covered expenses, say 20%, 25%. So you're insured, but you're on the hook for a certain percentage of the cost. And this is usually placed on out-of-network, or you could have in-network, which could be 20%, out-of-network could be like 40%. So it's just a co-insurance requirement, sort of like similar to a copay, but different. So when we talk about copays, this is something you're probably more familiar with, where you're going to pay $40 to see your physician, or maybe $60 to see a specialist. So these are a copayment you make at the time of your visit. Okay, so annual limits on out-of-the-pocket expenses. So this is going to be another typical feature where annual limits that you're going to pay out of pocket for. So the ACA has a limit of about $7,000 for individuals, $14,000 for families. A lot of plans will have a lower limit than that. Typically, $2,000 or $3,000 limits for individuals, $4,000 or $5,000 or $6,000 for family, and that's specifically for medical expenses that can be counted towards meeting the annual limit. So that means that you get to a certain point, and if it's, say, you have a co-insurance or agreement, you reach that annual limit, and then they're going to pay for everything. There's no more co-payments. Now, we talk about cost sharing for preventive services. Typically, if you're going in for routine preventative services that are not subject to cost sharing provisions or deductions, co-insurance, co-pays, then you're not going to be responsible for paying anything. So if you're going to receive care for, say, an annual checkup or immunizations or flu shots or vaccinations or any types of screenings, then you're not going to be expected to have to pay any cost sharing for those preventative services. And it's a way of encouraging people to take advantage of these preventative services, because typically they'll lower the cost of medical expenses in the future if you go and get these preventative services. And then, of course, there's always going to be some non-covered services. So in the group medical expenses, they're going to have exclusions or limitations depending on the plan. So certain services for injury or sicknesses may be out of what's covered by the plan. So this is just something that you need to understand what's not covered. And that is typically, some good examples are cosmetic surgery is a big example. Also, if you have one corrective LASIK operation on your eyes, that's not covered, which you think should be covered, but there's certain things that won't be covered, so you always want to know what your coverage is. Okay. High deductible health plans with saving options. So this is another type of situation here where you could think of it as, sometimes it would be abbreviated as HDHPSO, which I usually know it as consumer direct health plans, which are something that's a little bit more up and coming, and it's a group medical expense market, I guess is what you could call it. Now, so it's a generic term for a plan that combines the high deductible healthcare plans with a high savings account or health reimbursement account, HRA. So it's sort of a high deductible plan, but you already have planned to put in a certain amount of money in your health savings account to help pay for these deductibilities. So people kind of think that these plans make employers more sensitive to the healthcare costs, and provide, financial incentives to avoid unnecessary costs. So it's a way of trying to make, in this type of healthcare plan, you're going to pay more, not for, say, your weekly payments to participate in the plan, but you're going to pay more whenever you get medical services. So the idea is you're going to think twice about unnecessary or repetitive health services or practices that you may not need. The downside of this is that people may avoid medical services that they need in order to try to save money, which will just make the problem typically worse in the long run. Okay, so let's look at, continue to talk about this a little bit. So a high deductible health plans with health savings accounts. I've never personally encountered this, but they are out there, and this is why you should know about them in case this is what you're offered. Now, as far as if you're going to have that favorable tax treatment in your savings plan, which means that the money you put in the savings plan you pay no tax on, you have to be covered under a qualifying high deductible plan, have first dollar medical coverage, not be enrolled in Medicare, not be claimed as a dependent. So, and the employer and employee can both contribute to the savings account. So basically, there's going to be a pool of money that you can use for your health care to pay for these higher deductibles. And it's almost like a gamble. So you're basically saying if you're young and healthy, you're not going to use a lot of medical services, then this plan is going to be probably the most affordable. So it's a way of getting medical insurance without paying a lot for it, and particularly would be more beneficial to younger people. All right. Now, you could combine this with what is a health reimbursement account. So a health reimbursement arrangement, the employee and the employer. So the employee would rely on the employer to fund with the favorable tax advantages, where reimbursements to the employees for medical expenses are not covered by the medical standard insurance plan. So it's a way of trying to make these high deductible plans a little bit more attractive, I guess, because the employer is going to take on some of that cost for you. All right. So here's some recent developments in employer-sponsored health plans. Health insurance premiums continue to rise, so that's nothing new. For the last 40 years, the cost of health insurance has been astronomically and growing quickly. The only thing that it's comparable to is the cost of college tuition. So, for example, I remember that when I first started working, my weekly contribution for health insurance was $10, and my copays at the doctor were $5. Now, today, it's typical that weekly contributions can be $100 a week, and copays to see the doctor can be $40. So you can see how much just the insurance has gone up in that 20, 30-year time frame. So employers are shifting more costs to employees through higher deductions or higher co-payments. So employers, every year it seems like to defray the cost of the increasing cost of the plan, they try to shift more of the cost to the employees. So that's been a trend for a long time. Now PPOs are the dominant health group in insurance markets. So PPOs are probably the most popular, in the health insurance industry, as far as probably at least 50% of workers are going to be covered by a PPO. Although HMO and POSs that we talked about earlier are gaining in market share, and those are becoming popular too. But the PPO is the most dominant, but it's becoming less so. Continued growth of high deductible health plans with the saving options. So we just talked about that. it was a rarity, but now that we're trying to include in the ACA, trying to include more younger workers, these types of high deductible health plans are attractive to younger workers because it's a significantly less cost to them if they don't need a lot of medical coverage, or need the medical services, I should say. Coverage for early retirees, this continues to decline. So for example, if you want to retire at 55, you can, but typically you lose your health insurance. And the government's not going to cover you with Medicaid until you're 65. So it makes it very difficult for people to retire before age 65 because they're going to have no health insurance. And to pay for your individual health insurance is just too prohibitive. So some employers used to offer early retirees continued health insurance until they reach the Medicaid age. And this is something fewer employers are offering anymore. So establishment of tiered or high performance networks. This is something that a new type of, how should I say, a way, this tiered, this is common, I would say, I've seen it most common in, say, like drug plans, where some drugs are tier 1, tier 2, and tier 3. Depending on the tier they're on, is going to denote how much you're going to pay for them. So the healthcare is going to be broken into these tiers. Think tier 1, tier 2, tier 3, as far as the medical care going to be provided. So the objective is to, encourage employees to receive care from the lower cost providers that are going to be in, say, tier 1. And then as you move up, if you want to go see somebody who's in tier 2, you're going to pay more. And if you see somebody who's a provider in tier 3, you're going to pay even more. So they can do this to physicians as well as drugs. So it's a way of trying to encourage you or steer you to the lower cost tiers, which would be lower cost to you and also lower cost to the insurance company. So again, it's just a way of, and this is like, say, for when you think about tiered medical prescription drugs, tier 1 might be all the generics, and tier 2 might be the non-generics, which are definitely more cost. All right. Here's the prescription drugs here. Jump the gun on that. Increase in employer offering wellness benefits. So this is a trend that's been quite common now and increasing so. So employers are trying to promote wellness. So they might have a weight loss program, a stop smoking program, discount on gym memberships, on-site yoga or on-site exercise facilities, nutritional programs, all these things to try to, they might establish walking clubs at lunch, anything to help keep you healthier, because the healthier you are, the less you use the healthcare plan, the less cost will be associated overall. And the ACA allows employers to give a wellness discount of up to 30% of the healthcare plan premiums, based if you meet the certain benchmarks of the wellness benchmarks. So the use of health risk assessments. So this, we could think of them as an HRA, a health risk assessment. And this is going to be evaluation of an employee's overall health, a history of their, medical conditions. So large employers increasingly are using these risk assessments to learn about their employees' health habits, employees' health past, and identify employees who might benefit from disease management. So if you have diabetes or asthma or heart disease, they could encourage you to, incentivize you to be in more of these highly, more involved health management programs. That way, if you keep on top of your health situation, say you're a diabetic, you keep on top of your wellness checks and your checkups and your prescriptions, then the less overall cost you'll be on the plan. Okay. Establishment of health clinics and telemedicine. So with the recent, dangers of going to the doctor in person, they have telemedicine where, and this is becoming more acceptable, especially after what we just went through in the year 2000, that you can receive medicine over the internet. And I've done this before. It works very well. So now a health clinic, these are ways of alternate ways of receiving treatment without going to see a physician directly. So having on-site health clinic inside the building where employees can stop by if they have a minor issue or problem and they can receive treatment for, typically non-occupational diseases or injuries that they sustained. So it's basically seeing like a little health clinic inside of the facility with a nurse, maybe a physician's assistant that could prescribe some drugs if you're not feeling well, or you have a cold, or you need some antibiotics, things like that. And this will keep costs lower because it's definitely lower cost than if you go see a doctor. And of course, telemedicine is a way of, giving the patient access to providers. Then, if you're in a very remote location, you can use that video telemedicine to access a broader range of doctors and specialists that you could see traditionally in a smaller, community. Okay. Tied to eligibility requirements for spousal coverage. So if you have a spouse, employers are trying to figure out new ways to reduce eligibility for your spouse to have coverage. So working spouses may be totally excluded if they have access to health insurance through their own employer. So this basically what they would say is like, okay, yes, you're employed here and your wife can be on our healthcare unless she has her own healthcare from her own career or job. That's a way of, trying to make each employer pay for their own employees without having too many additional dependents on the plan. It's a way of saving money. Application of analytics to employee benefits. So, data analysis, analytics, trying to get the data of employees' benefits and figure out some sort of whatever you can extract from the data mathematically, statistically, to utilize big data to figure out patterns or relationships that can help predict future costs or future issues that could be utilized to help lower the costs of the overall health plans or increase the outcomes of patients or employees participating in the health plan. So this is big data, and analytics is big everywhere, but it's going to be very big in the medical field, trying to predict, the utilization of employee benefits, detect changes in behavior that might affect the employee's benefits, motivate employees to participate in certain programs. So, using big data to try to have better predictions of your overall cost to the company and your cost of utilizing these different benefit plans. Okay. Here's a nice graphic where we can look at the annual premiums for single and family coverage from 1999 to 2017. So let's go all the way back in time to 1999. So just stick with single coverage right now. The coverage would be about $2,000 for the year for the premium. And now today, that coverage is about $6,000 on average for a single. If you look at family, it went from $5,000 to $18,000. So you could see that proportionally they've gone up about the same, because you get from 2 to 6, that's talking about a 200% increase, and from 5 to 18 is a little bit more than 200%, but this is a little closer to 7. So I think they've gone up in a similar percentage, but you can see that that's a great deal. In less than 20 years, the medical costs have tripled, more than tripled. Now, if you look at the distribution of healthcare plan enrollment for coverage workers by plan type, so here we have the HMO, the PPO, the POS, the healthcare with the savings account, the high deductibility with savings account, and conventional. We could see that in 1988, most of them were just conventional medical coverage with, it's hard to see with these colors because they're all blue, But as we go darker, we move up the scale, and we can see if we get to today, 27, not today, of course, but in 2017, you can see that the conventional is down to a sliver, and the HMO 14%, and the PPO, the most popular, at 48%. So you can see that this changeover. Think of conventional as almost like the pension system that was offered by companies. It's just too expensive for companies to offer a conventional plan anymore, and switching over to managed care has become the state of the industry, since the 80s. And it's all because employers are trying to save money, and managed healthcare plans save money in compared to conventional plans. Okay. Now, let's talk about some contract provisions that these medical expense plans will contain. Now, coordination of benefit provision, which is going to be, it specifies the order of payment when an insured is covered under 2 or more group health insurance plans. So it's possible for somebody to have more than one group health insurance plan. So this could be typical of someone who might have Medicare and a medical plan from their employer, or they might work 2 jobs. So this would specify who pays what in what order. Consolidated Omnibus Budget Reconciliation Act, or COBRA, in 1985. This is an important act because if you leave an employer, you get separated from your employer, this gives you a provision to continue your coverage for a limited period of time after you're separated. So you don't get completely thrown off your insurance. You have the ability to continue your insurance for X amount of months, but you're going to be paying the full cost of that insurance. The employer will no longer contribute any money towards it, but still will be less than if you got your own insurance. Now, the ACA, individuals who leave their job for any reason or lose their job and lose their coverage, they may qualify for a special enrollment period to get into the ACA medical plans. Okay, so that way, because the enrollment for the ACA medical plans individual is at one specific time of the year. So this will allow you a special option to get into them to continue your coverage, which is a good benefit. Now, continuing, there's the Health Insurance Portability and Accountability Act. So under this, you have the right of the insurers to limit coverage to pre-existing conditions. It places restrictions on this so that companies can't say, like, listen, you have this diabetes, so we're not going to pay anything if you join our medical plan towards that because you already had that. So now it's more difficult for insurance companies to limit your medical insurance based on pre-existing conditions. And with the Affordable Care Act in place, that came after the Health Insurance Portability and Accountability Act, it pretty much eliminates the ability for health insurers to exclude you from healthcare based on pre-existing conditions. This is also a hot topic for most elections where, when politicians want to eliminate the ACA, the opponents who want to keep the ACA will say, listen, you're gonna lose your exemption for pre-existing conditions if they remove the ACA, and then the other side will say, well, we're going to keep that part of it. So it's politicized quite heavily. Okay. All right. So let's move over to dental. So dental insurance is an important insurance to have, especially if you have a family. So some individuals can get away with not having dental insurance if you have really good teeth. But if you have a family, typically children are going to need braces and things come up as you get older, routine visits. So typically the group dental insurance is going to cover x-rays, cleanings, fillings. And there's usually, similar to the health insurance plans, there are going to be deductibilities, there are going to be copay, co-insurance. There could be a maximum on benefits. and some dental services will be excluded, especially if they're preventative. So the dental plans are less expensive than the healthcare plans, but still, it's a type of insurance that for some individuals, it's a good insurance to have. Most employers offer it, but not all employers. And some of the dental plans can be, almost not worth it. They almost pay almost nothing, but expect you to pay a great deal every week. So you should really kind of look at, it's rare that you're going to have a dental emergency that's going to cost you thousands and thousands of dollars. If you're typically going to have, you got to figure out, if I'm going to be paying $2,000 a year for dental health insurance, and I typically only use a couple $100 of dental care a year, it may not be worth it to get the dental insurance as an individual. Something usually more beneficial for families. Now, group disability income insurance, this is important, and of course not all employers have to offer this, but most states will offer short-term disability, but for long-term disability that will pay a significantly higher amount of money, cash payments to employees who are disabled from accidents or sickness. The short-term plan is only going to last for about, anywhere from 13 weeks to 2 years. But longer-term plans can cover you for life, or until, say, Social Security kicks in, depending on how it's developed. Now, there's an important distinction whether or not the disability occurred from something you did at work or what they call non-occupational, which would be an accident that occurred outside or off the job. So this could be significant depending on how your coverage is. So you want the disability coverage that's going to cover you for both occupational and non-occupational disability. So an employee must be totally disabled to qualify. It means that you can't work at all. So you're considered totally disabled if you're able to perform each and every duty of your regular occupation, not just some duties. Okay, so for longer term plans, like I was mentioning before, which is going to cover you till retirement, these are a little bit different than the short term, and probably much more important, because if you say you studied for multiple years and then you become a doctor and you have $200,000 of student loans, and 4 years into being a doctor you have a skiing accident and you're unable to perform any medical practice. Disability insurance is going to be key to you being able to pay back those student loans and live with income. So it's, if you're a highly trained individual and have student loans and other obligations, family obligations, long-term disability, is definitely well worth it. Now, and the fine print is how, and oftentimes the insurance companies will fight. You may have to hire a lawyer to prove your disability and that you're not able to perform all of the material duties of your occupation. Now, after 2 years, you can still be considered disabled if you're unable to work in any occupation for which you are fitted for based on your education, training, and experience. Plans typically cover occupational and non-occupational disabilities together, and that's what you want. So if the disabled worker receives Social Security or disability benefits, the payments are reduced to encourage fraud or moral hazard, which, has to be taken in consideration that, we don't want people abusing the long-term disability. And there are plenty of cases where people are disabled, but, you see them performing physical tasks, mowing the lawn, exercising at the gym, even though they're supposed to be physically disabled, that are, continuing to, reap the benefits of disability insurance without working. So many plans, they want to limit this type of behavior, of course. So, it's become too commonplace for number of workers to hide out in disability coverage when they're totally fine to go back to work. And it's something that, raises the cost for everybody. Insurance companies do fight against to try to prevent that from occurring. All right. So let's move on to the next slide. Some long-term plans have additional supplemental coverage. So this is under cost of living adjustment, which is a nice additional to have. Benefits will be increased based on the cost of living, which is tied to inflation. Under the pension accrual benefit, plans can make a pension contribution so that disabled employee can still remain in their pension, even though they're not working. Although most people don't receive pensions anymore. If you did receive a pension and you had 3 years to go to qualify the pension, this is a very important aspect to have. So if you do wound up having an employer within a pension, you want to make sure your disability will make these continued payments into the pension for you. Survivor income benefit provision means that, monthly payments to an eligible surviving spouse or children will be paid for a specific period following your death. So you're disabled, you're on disability, and then you die, there can be additional benefits paid out to your family. So another important thing to have. Cafeteria plans, this is going to allow, the employees to select benefits that meet their specific needs. So basically you get sort of like a menu, and each employee has a certain number of dollars or credits to spend on benefits or take a cash return. So many plans will allow employees to make their own premium contributions with before tax dollars. And so under, it could be, under a full choice or a full flex plan, employees select from a range of benefits. So they sort of, they're going to decide, what works best for them. Now, this makes it often very difficult for employees to figure out what to do because they're not medical experts. They're not healthcare experts. So that's one criticism of these plans. So instead of getting like a single benefit package is going to apply to all employees, this is obviously going to let you decide what to do. So, but in many cases, many employers will allow you to say, okay, you can reject coverage. So I'll take the health coverage, but I'm not going to take the disability, the life, or the dental. And I think that can be considered a certain type of cafeteria plan. But the most common would be the full choice plan. This is, I guess, couldn't be referred to as a full flex plans. And this is the type of plan that enables employees to select, the full range of benefits. And they're typically a core plan. So a basic core benefit that all employees get. And so in addition, there's like a second layer of options you can add on top of that. And that an employer can give you a certain amount of dollars or credits can be spent at different benefits. Now, think of it sort of like if you're going to get a cable plan, you can get basic cable to cover a certain amount of channels that everyone gets, but then you can have an expanded cable plan, then you could have the premium channels added to that, if you chose to at a later date. So it's sort of like you designing your coverage. And speaking of like premium coverage plan, many of the cafeteria plans are premium coverage plans. So there's basically a generic name for a plan that allows employees to make their premium contributions for plan benefits with before tax dollars. So premium conversion plans are commonly used for group health and dental insurance. So employees elect to reduce their salaries, and their salary reduction is used to pay for the plan benefits. So in effect, employee premium contributions are paid with before tax dollars. I don't recommend this. Flexible spending accounts. So the cafeteria plans typically make flexible spending accounts to group insurance participants, so you can use the FSA to permit, which would help employees pay for certain unreimbursed medical expenses with before tax dollars. So again, this is if your plan's typically going to have a lot of unpaid expenses involved in the plan, you could utilize this to see where I am. It's to use this to help pay for those. And what's nice is they can give you that grace period or carryover period of some of the unused spending account funds. So if you do, this is a really great benefit because you don't ever want money to go to waste. So if they let you carry it over, if you don't use everything, this is what makes these flexible accounts hard because you have to kind of guess what you're going to need. So if you guess that you're going to need $2,000 for the year, but you only need $1,000, that's a bummer. So if they give you a grace period, they can give you up to 2.5 months after the plan ends to spend this money. So this can be used to pay for other medical benefits, other medical costs to the balance. And the carryover, they may let you carry a full $500 of unused FSA money into the next year that you could use for future plan costs that may occur, rather than forfeit or lose this money. So that carryover provision is pretty important. Okay, our last slide here. The one advantage of cafeteria plans is that employees can select those benefits that best meet their needs. So that's a great thing. So you can kind of tailor the plan to what you need. But the disadvantage is that the employer may incur higher development costs to put this plan together. So, basically the administration cost and establishing it and managing it may be high because it's a more complex plan. So the administrative complexity is going to increase when you're offering all these different plans and all these different decision points for employees. And you're going to have to answer more employee questions and more employee training would be needed. But on the other side, as if you're the employee, you can probably select what you need and reduce your cost and not take certain coverages that you don't need. And you're going to be paying most of your costs with pre-tax dollars, which makes it, cheaper, of course, because you don't have to pay state or local taxes on that money. And employees can more easily control, rising employee benefits costs. So based on, changing this cover in a year-over-year type of format. So it can be complex for, employees often feel overwhelmed when they're presented with all this insurance information and what to choose. And, oftentimes employees don't want to spend the time to research everything and look at everything. And this is where, a significant field is here for employment, that people who are experts in understanding HMOs, PPOs, medical plans, group insurance. You understand all that. You can be someone who provides advice to individuals or be hired by corporations to provide advice to their employees so everybody can get what's going to work best for them in their insurance plans. And you can see just from this chapter, which is a very high level look at insurance, group insurance plans and group life plans, that it's complex and there's a lot going on here and it's very difficult. Even today, I've had the same medical insurance plan for 10 years. I don't fully understand what my coverage is and on every aspect. And I just hope that the plan, like a lot of us do, hope the plan is good enough that's going to cover me in most situations, but I'm nowhere near an expert in my own plan to formulate something that we all should do a better job is understanding what is the current medical insurance plan I have, what does it cover, and what's the best way of taking advantage of this plan to get my healthcare needs met at the lowest cost to me. Okay, so that's the end of Chapter 16. I look forward to talking to you in Chapter 17. Chapter 17 is going to talk about retirement plans, which is a little bit more fun of a topic to talk about than healthcare and dental care. It's all kind of disability, all kind of depressing information here, but necessary. But next chapter will be a little bit more uplifting, I hope. Okay, take care.